Another very important thing here on New Day Cleveland, folks. What if doctors could predict who is most likely to fall and perhaps even prevent that first fall from happening? Well, Dr. Jay Alberts is here. He's from the Cleveland Clinic. He's a researcher, and that's doing just that. And it's one of those things like, I guess you see other people be the way they walk, or you've heard about somebody fall. It's really a sort of a scary thing for folks, isn't it?
Yeah, falls are a major consequence in terms of quality of life and transition to dependent care. And so it's super important to be able to predict the falls. And our previous models were really based on, we will predict if you fall, but only if you've already fallen. And so our problem has been we don't predict that first fall very well.
Trying to figure out what's going on.
Exactly right.
Yeah, so is it a muscle thing, or is it an electrical brain thing, or what?
It's probably a combination of both, right? You think about walking, and it's obviously you have to process information as you're walking, right? Think about Cleveland, avoiding potholes. And as you can see there, it provides an insight into, cognitive function and also motor function, because you're doing both things.
So can you see, like when you're watching these people walk, can you see like a potential problem, or you see an evident problem?
Exactly. So you can see some evident problems if they're obvious, but the problem is we can't with the naked eye see the more subtle or the nuanced. And so here you see, for example, what we're going to be doing in the new neurological building at the NI.
It's beautiful.
Is to basically instrument the walk of the individual, and so we'll have a great level of precision about their walking. That will tell us their speed, their arm swing, and all of those are factors that go into predicting that first fall.
So you think when you're starting to have a problem, maybe your arms are trying to compensate for your balance, almost like a guy in a tightrope.
For sure, exactly. And so, or maybe your arms aren't moving the same amount of direction, and so or path, and so you can't see that very well from just visually. But with the way we've developed the technology, we can then have that information and provide it to the provider.
I remember when I was growing up, and I'd call them old timers, and they'd have like a cane or a stick, and they didn't necessarily need it to walk, but they'd use it for balance.
For sure.
Is that evidence of anything?
Yeah, well, I mean, obviously of balance problems. But again, what we would like to do is to identify that earlier. So if we can identify specifically the problem, then we can have a very patient-specific approach to rehabilitation, rather than just saying, hey, go get some rehab and prevent your fall.
Yeah.
Well, we have to figure out, be more precise. What aspect should we be working on? Is it muscular? Is it cognitive? Or
that's what I wondered.
Very precision medicine.
So exercising the lower body, making your legs stronger and that sort of thing, would that have something to do with it, or is it navigation in between the ears?
Well, it depends on the person, right? And so that's the interesting thing. And so I think, obviously, let's say if you have trouble going up steps, that's probably a muscular issue. If you have trouble as you're walking and your phone rings, that's probably more of a cognitive issue. And there are things that we can do specifically, obviously, strengthen your legs, and there's also dual task type training to help overcome some of those cognitive issues.
What would dual task training be?
So that would be something like you would be walking and, let's say, counting backwards by sevens or something like that.
Wow.
Right? So it engages your cognitive system while your motor system is also activated.
So the navigation, like between your ears, has got a great deal to do with this.
Super important, absolutely. We're not robots. We don't just walk like automatons, right? So you're processing information all the time, right? Avoid the table, avoid the pothole. Right. Don't spill your coffee,
So we mentioned a bunch of times, or I mentioned a bunch of times, about being older people. How young can this happen to people?
Yeah, so if you think about some neurological diseases, you see it be 5 to 7 years sometimes before clinical diagnosis. So it could be 55 and older, really.
What should somebody do now if they have questions about this, they want to know more, or they want to talk to somebody about it? What should they do? Yeah,
I think always it's good to be an advocate and talk to your primary care provider and just mention that you may have some mobility issues. Or
you can steer you the right direction.
Yeah, exactly right. And steer you to the right direction and to the right provider, right? And so, for example, maybe it's physical therapy, maybe it's speech therapy to help compensate for some of the cognitive issues that may be going on.
I mean, you talked about walking backwards 7 numbers at a time. I mean, that make me fall down right there.
Yeah, well, but we've shown that in Parkinson's patients for sure that it improves mobility. So these things are changeable for the most part.
That's great. Well, thank you very much.
All right.
I mean, really fresh, new information. Great stuff. Thank you very much.